the NHS app is to give patients full access to their medical records. I'm going to read into this more from the Times, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an article from the Times with the headline that the NHS app is to give patients full access to their medical records. Minister promised a digital overhaul of the health service as Sir Keir Starmer asks the public how to fix the NHS. Guys, while you're here, make sure you hit the like button and share it across social media so others are notified of this video. Asks the public how to fix the NHS. I'm going to take that bit there with a massive pinch of salt, because I don't think it's a very good idea to ask the public about how to fix the NHS when you're the government to do so. So I don't know how true that is. I have heard that story one or two times coming around, but maybe some people in the comments will say that he's definitely said that, but I have yet to hear it myself. But anyway, let's talk about the NHS. The NHS's app in particular. Now, should the NHS app should you be able to access your medical records on there? A part of me says yes, and then there's a part of me says no. So the yes in me is that obviously that you can allows you to look at your own records to see your records, your health record, and your history yourself. I think it could be a good thing that maybe may help, especially if you're somebody who suffers from certain things. There may be your past history of things that perhaps maybe you've forgotten about, that you've had before, that you've been in hospital in the past for, or something you've had checkup for. Maybe something that comes back to your acknowledgement in your records. So in that regard, I could see it being a useful and helpful thing. And it's your medical records. You should be, it's very logical for you to say, well, this is it's my body, my healthcare, and I should know what my records are. I should be able to see it, shouldn't I, as a person? So I suppose there's that thought of it. The other argument maybe some people might make, and this is tangible, and I know some people will say it's very unlikely, but there could be a security reason for it. If the app was to ever get hacked, I know it's highly unlikely, but there is always that possibility, depending on the companies behind it who run the NHS app. Could put medical records at risk, so there is that possibility of doing so, and maybe it's better to not have it on the app itself. And this is obviously more about whether or not how important the NHS app will be, and I have to say that I do think that the NHS app needs to be obviously consistently upgraded, needs to be improved, and it can make help when it comes to people's healthcare. But as of right here, right now, it's not something that's going to, in my opinion, as of right now, reduce the backlogs. There's a lot of, as we know, the situation is a case of people need treatment, people need those actual one-to-one doctor appointments or nurse appointments. That's what people need right now. There is a case, obviously, for the NHS app. I'm all for the NHS app. I'm all for improving and enhancing technology. But is this the main priority? I don't think it is, but I could also understand why some people are wanting to prioritize. I can also understand why the government is instigating the use of prioritising the NHS app more, as what may in the future be able to help reduce the needs of people actually going to the doctors or GPs for appointments and whatnot. That perhaps maybe the app can be more of make things more easier for them. I wouldn't be surprised in the future if they create some kind of AI interface on the app as well to talk to people about their conditions and whatnot, as well as something that could be used to identify what some symptoms and things that people have, as opposed to a person. And it may lead them in the direction of and it may actually lead them in the direction of whether they need to see a doctor, a GP, or maybe just see a chemist for a certain medication, potentially. I can definitely see some kind of AI being introduced here. Lots of food for thought about it. Anyway, let's read into this. So, patients have been promised full access to their medical records via the NHS smartphone app, as ministers changed the laws to require GPs and hospitals to use a single system. Sir Keir Starmer will ask patients and NHS staff for their ideas of how to fix the health service, with ministers working on a 10-year plan to move closer move care closer to home, digitalise service and prevent illness. Wes Streeting, the Health Secretary, has promised more tests and treatments in local clinics as he attempts to beef up GP surgeries to keep people out of hospitals. Family doctors will be paid extra if they can successfully reduce hospital admissions under plans being worked up by ministers that are likely to be tested next year. I would like to see more diagnosis take place, more tests and more scans taking place in local neighbourhoods rather than in hospitals. I'd like to see more things like minor injuries taken care of in services closer to people's homes rather than people having to travel to A&E Streeting had told Times Radio. He did not rule out charging patients for missed appointments, saying at this stage it's not something I'm looking at doing, but once we've got the system working efficiently, if we still have this problem of missed opportunities, then I might have to be more open-minded. So he's not ruling out the possibility of charging people for missing appointments. You've got to take into account there can be all sorts of reasons why people miss appointments. So I don't like that idea in any way, shape or form. Streeting said the NHS was going through the worst crisis in its history, but insisted that emerging technologies made it incredibly positive about the future. He said that on Monday that he and Starmer will be setting out an approach for a 10-year plan on health, which will involve the three big shifts we need. The involves making the NHS and a neighbourhood health service as a national health service, shifting from analogue to digital, and the shift is not simply treating sickness, but preventing illness in the first place. Yes, if we can prevent illness in the first place, obviously that's a good positive step as well. And obviously, by the time you guys see this, they'll set out more phase in that as well. I'm sure they will mention the Conservatives leaving the NHS in tatters as well. Ministers will today promise patients all the information, such as test results and letters, will become available through the NHS app, which is meant to allow online bookings and appointments. Under a data bill due to be introduced in Parliament on Wednesday, ministers will mandate a standard record-keeping system for all parts of the NHS so that information can be brought together and easily accessed by patients as well as staff working in different parts of the system. Streeting said the bill would enable us to better share patient record across the NHS so they could save around 1.5 million hours a year just through better data management. The bill would also make it easier for researchers to get access to patients' records, with ministers insisting privacy concerns must not be allowed to stop data sharing to improve care. Privacy concerns are important here. Streeting has already said that some responsibility for GP records will be taken by NHS England to ensure they can be used for research. He has not ruled out centralising control of all GP data if doctors do not share it. Starmer said it was time to roll up the sleeves and fix the NHS, ahead of launching their website today to asking for public for suggestions on how to do it. We have a clear plan to fix the health service. The clear plan, we've heard that all the time. It's only right that we hear from the people who rely on the NHS every day and have their say in it, shape our plans, and that we deliver it. I do agree that how much of that they're taking on board and what people in the NHS are saying is one thing, though. So they're saying that they're listening, but are they listening? That's the question. Streeting insists that consultation was not a sign that the government did not have its own ideas, citing the huge and continuous structural reforms introduced under David Cameron. Streeting said, "Be careful what you wish for when you say politicians should just come in and impose change without involving patients and NHS staff." Camilla Hoffman, chair of the Royal College of GPs, said changes to the local care must be developed in partnership with GPs and their patients, and with recognising the intense workload and workforce pressures that GPs are currently working under. She added many practices are already working in ways that are similar to the neighbourhood healthcare and described by the UK Health Secretary. I don't know why I said UK's Health Secretary there. But, yeah, I mean, obviously, one of the priorities, and I've talked about this in other videos, but I'll mention it here just for naysay for those who don't know, the NHS is going to be one of the biggest priorities at this budget. They're going to be given a huge amount of money because it's a political win for Labour if they don't fix this healthcare. As I've said in the past, one of the founding things, you cannot have a functioning government with a functioning society without a functioning healthcare. But more specifically, I want to say on the NHS app, I do think it will play a key role. I do think it will play its part. I do think more introduction of technology is a good thing. However, I still think it is also very important that people can still have access to their doctor and GPs and not turn to too much reliance on artificial intelligence, which is what I fear eventually that they will go down to. I do fear they will go down that path. And I hope it's... part of me is like, I'm not ready for that, But I can understand some people saying no, we should use AI because it could save doctors and nurses, doctors and GPs time with more concerning patients. And I can understand that point. But are we ready for that right now? That is a lot of food for thought. But in terms of the NHS app, yeah, give it everything. Give it the technology it needs. Give it what it needs to help make that difference. But obviously, there's still so much more that needs to be done. And obviously, if they are taking the inputs of workers within the National Healthcare Service, then I'm all for that. I just wish they didn't rely on the private sector, which is what Wes Streeting is doing to try and reduce the backlogs, which is one of the biggest problems that I have with Wes Streeting. And things that he has said about the NHS in the past have been, I have not forgotten either, which is why I don't trust them at all. But what do you guys think? What do you guys make about the NHS app? Do you think it should give patients full access to their medical records? What do you think about the NHS app in general? Do some of you use the NHS app? How have you guys found it? Let me know your thoughts and more on it and the NHS itself down in the comments section below. If you found this video interesting, please hit the like button. It'd be greatly appreciated. Share it across social media so others are notified of this video. If you haven't subscribed already, please consider subscribing, because it really does help support the channel. And if you want to go one step further, financially support me and the work that I do here, you can do so by becoming a YouTube member for as little as 99p, or join me on Rumble or Patreon for exclusive content on those platforms. So thank you all so much for watching, and I hope to catch you all very, very soon.